You ready to go? Yes, sir. All right, we'll go ahead and call this meeting to order. Roll call, please.
Chief Thornton,
Here.
Chief Allen, Captain Silvestri is sitting in for Chief Allen.
Here.
Brandy Davis, Lillian Pike.
Here.
Dee Dee Hayes. Here. Battalion Chief England.
He's here.
All right. So since we have everybody is there anybody online, YouTube, or participating WebEx or anything like that?
Not that I'm aware of.
All right. So we don't have to do that, right?
Right.
Okay. All right. Stephanie sent out the minutes for the September 2021 meeting a couple weeks ago. Everybody should have a copy of those and had a chance to read over that. Is there any questions or anything, any changes need to be made? All right, can I get a motion to approve those minutes, please? All right, I have a motion, and do I have a second?
I'll second it.
All right, motion and a second. Roll call, please.
Silvestri,
Sustain.
Pike,
Aye.
Hayes. Aye.
All right. Motion carried. All right, under old business, we have, first response, the mileage on the trucks. Chief England, you want to address that?
Yes, sir. This goes back to the previous one about the ordinance has been changed. Their trucks having 250,000 miles on them. Currently, they only have 2 trucks that has less than 250,000 miles. Mr. Childress has stated they have 2 trucks that are held up in customs. All I'm asking is we're trying to figure out how long those trucks have been in customs. When do he think that they will be here, that will meet the mileage, so they would increase the number of trucks that they have over 250,000 miles? Because right now they have several trucks that does not meet the mileage requirement of 250,000.
Mr. Childers, you want to respond?
Yes, sir. Good afternoon. Sorry for being a little tardy. We do currently have 2 trucks that's less than 250,000 miles. We have a couple more trucks that would have the new engines and new transmissions in them, but I know that there's not an allowance for that. The 3 trucks that we had on import, they will not be arriving. They could only be temporarily imported for 12 months and returned. So now we're in search of 3 other trucks that could be permanently imported if we decide to go with the Demir's product. If not, then we're going to be forced to purchase Type 1. Ambulance is has the pickup truck front end on them rather than the E-Series truck, because that seems to be the only thing out there that is even on the market right now. Trucks that are 300,000, 350,000 miles are still bringing $60,000, which it wouldn't make sense for us to buy anything like that because it doesn't meet your ordinance that we have. So we're currently searching, but we will have trucks by the end of the year, and we're shooting for 3. Our broker that we normally get our trucks from, again, I don't think the problem was with him on the importation, but he's currently searching for units as well. So if it just comes down to it, we're going to have to buy the F-Series trucks, which we would rather not, but if it comes down to it, that's what we'll have to do.
Just because I don't understand what that means, but what do you mean they was brought here and then had to be returned?
No, when we took and done the purchase contract on the vehicles, it's to my understanding, I'm not an exporter or an importer, that they have to be approved, and if they have a Canadian sticker in the door, there's some additional documentation that has to come along with the vehicles, and the municipality that had the vehicles before could not provide the documentation. That's what we're being told. Again, I'm not an importer or an exporter, but we've done business with this particular company since 2010, and we feel certain that they're going to find 3 trucks But again, before we reach the limit of December, then we will definitely have the F-Series trucks.
All right,
Thank you. The end of this year. The trucks that we have are permitted to the end of the year. Yes, sir. Any other questions? Sorry. Sir? Yes. Thank you.
All right, under new business, we got complaint number 10.
You did say complaint 2021, right?
Yep.
Okay. This was a complaint filed. One of our crews ran a call with first response, and there were some patient care issues that was noticed by our crew, by the hospital staff. Several times I reached out to Mr. Childers and Mr. Tyndall about having a QA/QI process on this one particular call. Asked several times and had no, could never get a meeting. After some text messages, it was sent to the state for their investigations. So currently, Alabama State EMS is aware of this, and Mr. Stephen Stringer is looking into it. I have not heard anything back from him, and it was turned in to them September 21st.
This was after you, is this the particular one that when you spoke to first response about this, they said send it to the state? Is
Yes,
this
sir.
one?
Chief, Board. We did go ahead and send this to the state since it was an issue of patient care. We want the state to be the deciding factor. They're the ones that make the rules. We did get a reply from the state, and the reply from the state, I think it was Mr. Collins. I'm not certain about the name, but it did go through Stephen Stringer. The paramedic in question here about the alleged displacement of the IO needle had to perform, per the state, an insertion of an IO needle that had to be witnessed by another paramedic, signed off by that paramedic that it was properly placed and inserted, and sent to the state, and that closed the matter.
Go ahead.
Okay, so you said the IO needle that was in question that day was properly placed,
No, I said the allegation of improperly placed.
and it was signed off by who?
No, maybe I'm confusing you. We turned it into the state. Then the state came back and said, you need to do remedial
Okay.
with a medic, and that was the other medic involved.
I think that's a close to that. I think it also probably would have been easier if we could just handled this. I think the same outcome would have probably come out of the whole situation instead of it having to be sent off to the state
And Chief,
and have them weigh in on it.
I would agree with that, only except for the liability issues. We wanted to make sure the state was aware, just for liability issues on that.
Chief England, did you get anything back from the state from when you turned it in?
I did not.
Check with that to close up this matter. All right, could you come speak on complaint 2021-11?
Complaint 2021-11 was filed by Decatur Morgan Hospital main campus for multiple delays in transporting patients out from their hospital to other facilities. What this does is this slows down the flow of getting bed space in the hospital. As patients need to go up, they need to go out. So there was one patient that held for 60 hours 2 patients held for 24 and 1 patient held for 16 hours amongst some other ones that's not listed here. We have Carrie has sent emails on this. They try to ask first response to roll these transfers to another service, either them or lifeguard or anybody could take it to try to help the flow of things in the hospital and first response did not want to do that. While this is a founded complaint because this did happen, I've spoke with Carrie about it and we understand that the process that first response uses for their billing practices isn't the same as the other ambulance services use. I've talked to several people, and the way they do their billing is not the same as the way first response does theirs. So that's a little bit of the holdup, I guess you could say, of getting these patients out.
Could you explain to the board what the difference is?
And correct me if I'm wrong, David, on this, but when first response has a transport that goes over 100 miles, they file for pre-authorization to the insurance company, whether it be Medicaid, Medicare, or any other provider. On that, they wait until they get pre-authorization, until they get that form back in order to make sure they're going to get paid for that. Some of the other companies that we spoke to, or that Carrie spoke to, is that they file for pre-authorization, but then they go ahead and do the transfer. So if it comes back and they get approval for it, then they bill for it. If they don't, then they don't take any money. They don't get paid for that call. It's just depends on how you want to do things.
Anybody have any questions for Chief England? Mr. Childers, would you like to speak?
Yeah, I'm searching for the email for you guys as well. You know, the CMS rule is apply for the prior authorization for the transport over 100 miles. We wait to get that. If you do not wait to get that prior authorization and you do it, you go ahead and you do the transport, and then it's denied, you have no appellate right at that point in time for payment.
That's what I was referring to some of the other services.
They just do it. All right. Chief England, you want to come back up here because you got the overturned stretcher. Can you tell us where we're at with that?
The overturned stretcher issue, I just combined 2 words. I went by the other day and spoke with a lady. She said that the lady that was there at that date was no longer there at that time, and she said I would have to come back and speak with her about that. So I'm still trying to chase them down.
All right.
Might as well
Just stay up there.
yeah.
All right, I was just gonna touch base on the CPNC for Decatur Morgan EMS is make everybody aware that it was passed by the council in the last council meeting. So everybody should have a copy of their application and a copy of their certificate also. Next item on the agenda is the September 23rd email request. Chief England, will you go over what you've asked for from first response? Y'all all should have a copy of this email also that was sent to you.
Okay. So, like Chief Thornton said, on September 23rd, AUMO First Response asking 4 questions. Question 1 is how many units does First Response operate daily? I asked them to please specify between ALS units, which is Advanced Life Support, and BLS units, which is Basic Life Support. Question 2 is I asked how many units does First Response plan to operate in the future? I asked them also to please specify ALS or BLS units as far as that goes also. Question 3, currently First Response only has 2 units, 326, 327, that meet the ambulance ordinance mileage requirement of 250,000 miles. Based on their 5-year business plan that they submitted at the same time they submitted their CPNC application, they said they would have 2 to 3 trucks here by September 2021. Currently, we're October 12th. I asked, Mr. Childer also said they were stuck in customs at the time. I asked if he could show proof of purchase of these units and expected arrival date, along with the mileage and number of units that he purchased. Question 4 is, I asked them to provide the exact number of units they operated daily for the months of June, July, August, and September, and also specify between ALS and BLS. The reason behind this is this is at the same time that Decatur Morgan had submitted their CPNC. We was trying to figure out what number of units that we needed to operate, how many first response units was operating, and how many units Decatur Morgan was operating at the time. So we could kind of get our heads wrapped around if we have 5 or 6 trucks like we've all said we needed, it's a little bit less trucks that first response has to have, and less trucks they got to have to meet in the middle, I guess you could say, to run these calls. I asked them to have the information back to me by September 28th, and I still haven't heard anything from them concerning these 4 particular questions.
Anybody got any questions for Chief England?
And you said we got a copy of that email?
You sent that out to him.
Because I didn't get that.
Okay, well,
So
We can get a copy made of this or send it to you.
I would appreciate that.
Okay. All right, Mr. Childers, you want to speak?
I have some hourly calculations I'll go over. First, I'd like to say that when we were approached with this about the number of units ran in June and July and August, as Mr. England just stated, so they could come up with a plan with the hospital on how many units, I find that to be just a little bit strange. That we're going to have to share how many units we are so a plan can be put in motion for another service prior to the application. However, we operate a system status management plan. We can go from 4 trucks, 5 trucks, 6 trucks, 7 trucks, 3 trucks, depending on how many calls that you have. Looking at history as well on the system status management and utilizing a unit hour utilization plan. We may have 3, 4, or 5 ALS units and need an additional ALS unit and close down a BLS unit to take a driver from the BLS unit to put with another medic to make the 6th ALS unit. That can happen vice versa as well, depending on the load factor of the 911s on the system status management. Our ePro system that we utilize to schedule paramedics as well as EMTs, it doesn't differentiate, is this a medic truck, is this a BLS truck, or is this an advanced truck? We don't have the way right now to go back and marry, if you will, those 2 names together to find out if it was a medic truck, a BLS truck, or an advanced truck. But we did calculate hours that will give us some kind of look at the man hours that we're spending monthly per paramedics and per EMTs, and that's the way we calculate our UHUs. For June, 2,671 paramedic hours, 4,337 EMT hours, so that shows that we're running a split of medic units versus BLS units, for a total man hours of 6,708 man hours on trucks.
What was those numbers again, medic and basic in June?
Medic 2,671, EMT 4,037, for a grand total of 6,708, 6,708. And again, those could have been ALS trucks, advanced trucks, which is ALS, or they could have been basic trucks. July, for paramedics, 2,841 hours. EMT hours, 3,905, for a grand total of 6,761. So you see, we're kind of close with the July and the June, and that's how you calculate UHUs. We looked at August. Paramedics was 2,480. EMTs 4,127, for a total of 6,638 on there. Again, you could be running double medic trucks, you could be running single medic trucks, you could be running advanced EMTs and a BLS for an advanced truck, or you could just be running 2 EMTs for a BLS truck. September, 2,039 for paramedic. EMT, again, EMT-B and EMT Advanced are all in the same categories under the EPRO. 3,648 for a grand total of 5,688 hours. Again, our EPRO system doesn't differentiate how many medic units did we have Monday. So we're not able to do that. The only way that I think it's possible is to have to go back and just look on a payroll ledger and try to see which medics were there, which basics were there, and then go back through each patient condition report for that day and see which 2 people that were on the truck signed that patient condition report for that, which would be very laborious at the least, but we wanted to give you some kind of answer about the labor hours, and you can see our labor hours has been decently consistent with that. Any questions?
Yep.
How many trucks are you running today?
5 or 6 trucks today.
Today,
Right now, how many trucks do you have running today?
we have 3 trucks that are on shift right now, and we did have 4, then I came to the meeting. So 3 trucks right now.
Okay. Out of those 3 trucks, what's your ALS and what's your BLS?
There's 2 ALS and 1 BLS.
So you know how many trucks you're running that there's a way you can keep up with that without looking at hours.
Keeping up with it, yes, going backwards, that's the difficult part.
I just a few things I wanted to, you talked about BLS, advanced and mobile. Well, we don't have advanced,
Correct.
so that shouldn't even been a point of the conversation. What Mr. England said a while ago, it wasn't just for seeing how many trucks the reason we asked this stuff, it wasn't just for seeing how many trucks that, as you got, it said that, to help your competition, another hospital, it's the fact that you can look back in the month of August, there were 96 roll calls. We have to plan ahead. We have to look and see what's going on. It wasn't anything it wasn't to help them, it was to make sure we have adequate service for the department. You're right, you're the only one that had a CP&C in the month of August, and we had 96 roll calls that month. I mean, yes, we had to look and see what we could do to make sure we had enough coverage to make those calls. And just, I done a real quick math on it. You was saying the numbers of August, you had 2,039, I believe. If you had three ALS trucks a day, times 24 hours, times 30 days a month, that's 2,060. I know I looked at the CAD many times, and it would be 1 ALS truck and 2 ALS trucks throughout the month. I don't know exactly how those numbers add up to be on that.
August was 2,480.
Well, same thing.
And there again-
2,480. That even makes it even more out of whack when you see
Exactly.
1 or 2 trucks.
Well, exactly what you're saying when you try to apply the simple math of dividing by 24 and then take that number and say you're running 3 a day, 2 a day, 1 a day, 5 a day, that math will never come out because you've got people clocking in, clocking out at different points of the day. So at one point of the day, we'll take Himsey, for example. Himsey might be running 17 trucks at 2 o'clock. They're running 5 trucks for all of Madison County after 9 o'clock. So and I know what you're saying about the simple math, But that's not the accurate way to look at it, because you do filter trucks in as your call volume increases and out, obviously, as your BLS
I
decreases.
agree with you, but we also, all of us have access to the CAD, and we see how many trucks are, you know,
Sure.
how many trucks are running for both departments.
Sure.
Basically, what this email, what this whole conversation came down to is we asked them very simple questions multiple times, and it ain't really anything we can do about it or anything. It's just simple questions that we wanted a simple answer for. And now we're here discussing it once again, and I don't know why we just can't get simple answers to simple questions on these things. But we will go ahead and send this out to the board members in case something happened that didn't get it. We'll just forward this on so you can have this and know what it is.
I've got a suggestion on that, and it's an ongoing issue. What I would suggest, if the board is interested in going this route, we have got in the ordinance, punishments or penalties for misrepresentation of facts. It never entered our mind when we were drafting it that they would just say, no, we're not gonna answer. If the board is so inclined, we could make a change to the ordinance that requires, you know, that would allow for some sort of repercussions if they refuse, if any service just refuses to answer questions. And if y'all say y'all are interested in doing that, I could draft something up for y'all to review.
And I think it probably, maybe draft something and we can discuss it with the full board next month, maybe, so we'd have everybody here for it. It's just sort of like what we talked about previously with the IO need on it going to the state. I mean, it seems like there's so much, it's a lot harder than what it has to be, what it should be.
Okay, I'll get something before the next meeting.
All right. All right, next on the new business is the Morgan County 911 dispatch plan. Chief England, will you go over that?
Each one of you should have received a copy of this, except for you, Captain. I don't know it. There you go. This is a plan that, according to the ordinance, section 328 in the ambulance ordinance, that the DFR chief and the MS coordinator will develop a response guideline when there's multiple providers. Myself and Chief Thorne sat down and came up with this. We had the help of Ms. Ferris, from the director of Morgan County 911. We feel like this is the best plan of action right now for this. Basically, if it's an emergency call, it's based off AVL, of location of your trucks. If your truck does not have AVL, then they will not be dispatched to an emergency call. One of the side things of that is we didn't want an ambulance to be sitting 2 blocks from an emergency and them know we're 2 blocks from emergency, and because they have some equipment failure, not be able to respond to that. So we did throw a thing. There is a plan in there that if they're closer and they know they're closer, that they can radio dispatch with their current location, and they'll be assigned the call. We had a meeting last week, I think it was last Thursday, with myself, Tyler, and Carrie from Decatur Morgan EMS, Mr. Tyndall, Mr. Childers from First Response. We went through this line for line, letter for letter. We added one clause in there that Mr. Tyndall brought up, which was a very good one, that if they carry a patient, if there's no contracts involved and they carry a patient to a dialysis clinic for cancer treatment or something like that, if they carry that patient in, then they're the ones that go back and pick them up and carry them back home. It's also a thing in there about if anybody goes out and gets contracts with different types of businesses to provide that service, they're the only ones that can use that in case of non-emergencies. If there's an emergency at that facility, then it goes back to the closest unit to get dispatched.
Just to clarify one thing Chief England said, if it's a closer ALS unit that the AVL is not working, it will go to an emergency. We will reassign an emergency call to a closer unit, even though their AVL is not working. But no AVL, if your AVL is not working on a routine transfer, those do not get reassigned. So the reassignment only works if it's an emergency call.
And the basis of that is going off AVL, that gets you the closest unit available, closest ALS unit available to that emergency call.
And like he said, everybody was in attendance and agreed to, thought this was a good plan moving forward. Anybody have any questions for Chief Ingram? Next, no questions. Do I get I need to get a motion to
I have a
approve this?
question.
All right.
I have a question, and it's not for you. It's,
We're good.
it's for you, Kelly. I'm sorry, since you're the only one from 911. You have to come up here, though. Sorry. You get to be in the hot seat for a minute.
Well, and I'm the proxy, so I'll try to
I know,
answer.
I know, I'm sorry. First question, how are you guys doing on staffing? Are y'all good at staffing now? I mean, y'all weren't down staffing.
We are down staffing. We have 4, I think, in training.
Okay.
So we're full, but they're not fully trained yet.
So with us having a new ambulance service on board, is this gonna require additional dispatchers to run this service? Will more be assigned to this? I mean, because I know this is gonna require a little bit more than just having one person dispatching this ambulance service here in Decatur. Because you're gonna have to look to see who's gonna be closer now, you know, in this area. Is that gonna require more eyes on the screen?
No, it's still one call for service at a time. We currently assign the closest first response unit. So we're still looking at the same screen. It'll just be whether it's a first response unit or Decatur Morgan unit.
Okay. So as far as like with, right now, we're having issues with the reporting, as far as with our time reporting and stuff like that. And I know that's still a problem. We still can't get that reporting.
I think August went out, is that correct? They have August.
Okay,
So that part is fixed from when they added a filter.
okay, good.
September isn't done because the person who knows how to add that filter is battling some health issues, but that should be done by the beginning or end of next week, I'm sorry. And we're gonna get another person trained up on that since we got some health issues there.
Okay, all right, that's all I have. Thanks. Appreciate it. That's all
Do
I
I
have.
have a motion to accept this dispatch plan?
So moved.
All right, got a motion, do I have a second? All right, motion is second. Roll call, please.
Silvestri. Pike.
Aye.
Hayes.
Aye.
All right, motion passed. Next on new business is the Decatur Morgan Charge Master Plan.
All right, and each of you should have a copy of this also. Per section 337, the provider, which means either ambulance services in the city of Decatur and the PJ, must submit a charge master or fee schedule to the ARB board to be approved. And this goes down the line, this is how much they're gonna charge people. Per mileage, if they do a standby at a football game, this is how much they can charge for that. And in order to charge for standbys, you have to have this in the charge master. You have BLS, ALS, all these different charges on there. Like I said, this is 337. And this must be approved by the ARB board.
Do we have any questions, Chief Ingram?
Charge master up there. If you want to, I've got a copy of First Response's charge master if anybody wants to look at it to compare it real quick. Really,
Do you have a current copy?
first response? It's the 2017.
Okay, that's what I got there.
So I'll just tell David, we need to update theirs.
All right, has anybody got any questions? Do I have a motion to accept Decatur Morgan's charge master plan? You have a motion, do I have a second?
Second.
Motion second. Roll call, please.
Silvestri. Pike.
Aye.
Hayes.
Motion carried. Chief England, will you go over the DFR monthly report?
Like Kelly said earlier, been having some health issues at Morgan County, the person that does these reports. I did run some this morning looking at ours through our system, and right now within the city, we're at 93%, and the PJ, we're at 100%. But that's not the official numbers, that's with me looking at our reporting software and ran some numbers.
You said 93 and 1.
93 for the city and 100 for the PJ.
Do you have our August?
I
You
presented
went over
that
it last
time.
meeting, didn't you?
Yes.
Okay. All right. Are you, or Jason? What about August? They sent August out the day of the last ARB meeting,
Yes,
and
sir.
you said you hadn't seen it yet?
No, I've seen it, I just didn't bring it, I didn't know we were gonna go with the August report.
All right,
When, September, a month later, my apologies, I didn't know.
ain't no problem. Do you happen to remember what your August numbers were roughly?
No, sir.
Just to kind of give everybody an idea of what we're looking at, so they're not surprised when it comes down. From Samantha Sanders at 911, first response for the month of August. For the month of August, their city fractal percent was 64.1, and PJ was 77.8. So I just wanted everybody to make sure we kind of was on the same page with what the times are on that, so it don't come up as a surprise later on in the quarter. All right, the next thing on our agenda is discipline reviews. Chief England.
Like I spoke on the last time, first response, this board upheld the fourth quarter financial penalty for fourth quarter for 2020 as a $10,000 or $5,000 financial penalty. It was forwarded on, or it was upheld by this board. It should go to city council next for their vote to uphold it. Mr. Childers and Mr. Tindall, first response, have yet to put it on the city council agenda. I feel like this has been a while. I feel like it needs to be put on the city council agenda to be heard for city council to either uphold the ARB vote or decide what they want to do on it. So they can uphold it, they can dismiss it, or they can decrease the amount of the financial penalty.
So it was for the fourth quarter of 2020.
Yes, sir. We heard this.
Times were out.
This was heard by this board in February of 2021.
And what was the penalty?
$5,000. It was initially $10,000, and that's the same time it was discussion about lowering the penalties, and Captain Ward at the time voted through what's the word I'm looking for, Chip?
Made a motion.
Made a motion. Couldn't think of that. To lower it from $10,000 to $5,000, which was match what the current financial penalty would be.
Is there any points penalties on this?
I think there's 2. I would have to look back and see. 2 points penalty. I think, don't hold me to it, I'll have to look back and see on that.
I think it's,
Wow.
Is it 5?
I think it is, but I'd have to look.
can
It's in section 320.
you look at that?
Yep.
What?
I see your, ordinance.
You don't have your own?
That's it.
10 points.
10 points.
Yes.
Just for I guess frame of reference, I said earlier that it was not contemplated when we wrote the ordinance that we took into account answering falsely. We didn't take into account just refusing to answer, which is what we'll work on for the next meeting. In this one, we, because of the financial penalties, and the appeal to the city council, never crossed our minds that they just wouldn't appeal and still wouldn't pay, and we overlooked the 14-day limit that we put on all the other appeals. And so in the ordinance revisions that were adopted by the city council, across the board, the appeals are 14 days. My suggestion would be that this board verify or confirm the earlier finding of a violation and the penalties that go with it, which would then start the 14 days. And if they appeal, the city council will get it. If they don't appeal, they'll have to pay it.
I thought we already did this in a previous meeting.
If we did, I
We did
wouldn't
the
hear.
14 days.
That was. the change.
We approved that change,
But I
but
thought we
they
did
didn't
that.
reinstate it.
I thought we did that at that point. We said from that day forward, we'd start counting that 14 days.
I think we talked about that, and I may be wrong, but I think we talked about that's why we were doing it, but I don't think we ever voted on it. And I'd have to defer to Ashley and Tracy on that. I don't recall it happening, but I missed a couple of meetings.
We did talk about it and then it went to council for them to vote on it to implement that 14 days. So since that time, between when council voted on that to institute that 14 days, this is our.
And I think a lot of this kind of gives a little confusion because we went from it being $10,000 to $5,000, and I think it's what Captain Ward suggested that we make this mimic what we thought city council was going to pass with that. Mr. Stewart, you got anything? Has this been paid or has it been appealed?
It has been appealed. I do have a question at the end of the meeting on clarification on the ordinance that this board hopefully can give us. We had, first of all, I don't know the legalities. Mr. Alexander would know that. I don't think you can pass an ordinance today and put it retroactively to December 2020 of last year. I don't know about that. But I do know that we did one appeal prior to this. And we appealed it to the ARB, and the chair of the ARB forwarded it to the city clerk, and the city clerk put it on the council agenda. That was the previous city council to what we currently have now, okay? So that's the way the process was then. That's the way we thought it was, again, when we appealed here, formally appealed here. In section E on this 340, it's talking about the appeal process. If approved by the ARB, greater than $1,000 may be appealed to the city council upon filing a written notice of appeal with the city council or city clerk. Who files that? The last appeal we made, the chairman, and I'm not trying to say anything against you. The last time we filed an appeal, we publicly came up, made the appeal to then Chief Grandy. He made the written, I'm assuming it was written, we have no notice of that, notice to the city clerk, and Miss Gilly put it on the ex-city clerk, put it on the council agenda a couple of months later. And to our understanding, that was the process at that time when we made the appeal to this ARB.
Legally,
Me and you spoke
yeah,
about
whoever is appealing is the one that files it. In a criminal case, civil case, administrative case, the person who doesn't agree files a written notice of appeal, and that's what gets it to the next level.
And
So,
I'm sorry, if I may make a suggestion, let us on our part, talk to our legal counsel about this one particular issue, and then have an answer at next month's meeting for you, solid. If we're instructed that we need to go ahead on our part and hand a letter to the city clerk, as soon as we're instructed to do that, we will do that. But if not, then we'll have you a 100% answer at the next ARB meeting.
legal.
That's yeah, I mean, it's been a lot of months. If they want to appeal it, they just got to put it in writing and send it. And this, what you're about to vote on, just gives them 14 days to do that. But it's up to you about whether you want to table it or what you want to do with that. But
Your new ordinance cannot be retroactive back to 2020. We know this.
I don't think the ordinance was retroactive. Like I said earlier, Captain Ward suggested reducing the penalty,
Okay.
but it wasn't retroactive.
I understand. I would request that just let us talk to our legal counsel about this one particular issue and report that back to you. That's a request from first response.
So we've had this same conversation last month, or the month before last. I think it was last month, because Mr. Children was sitting right back there, and he asked who has to submit to the city council. And we had the same conversation about them being appealing, that it's their responsibility that they appeal it. It is the same conversation we're having right now.
And I do remember that. However, your ordinance doesn't specify who does the written notice of appeal to the city clerk.
But why would the city appeal its own ruling?
No, forward, and I know that
File a
you,
written notice of appeal is the
Right.
person that's appealing.
I understand what you're saying,
Yeah.
Mr. Alexander.
All right,
What-
so what you're asking for is for one more month.
Yeah, just let us
Do I have a
seek
motion to
clarification.
Table this till the next meeting and give Mr. Childers another opportunity to talk to his legal. All right, no motion for that.
All right, so you move forward with the vote.
All right, so in that case,
With
I
the
need a
motion and
motion.
second, right.
Yeah, I need a motion for, to say this is properly penalized and according to the amended ordinance, that he has 14 days to appeal or pay. Do I have a motion?
So moved.
Have a motion, do I have a second?
Second.
All right, motion is second, roll call, please.
Silvestri,
Aye.
Pike,
Aye.
Hayes.
Aye.
Motion carried. All right, does anybody have anything different, or anything else to add to the, meeting? Any comments? All right,
Just for clarification. In section 328, it's talking about multiple providers and response plan, as Mr. England spoke about. It's just the last sentence in there. I just want clarification. It's talking about cooperating seamlessly with response to emergency calls, period. And then non-emergency transfers and transports not dispatched or forwarded by E911 will be the responsibility of the provider individually. Can there be clarification I'm wondering how can non-emergency transfers or dispatches, or excuse me, non-emergency transfers or transports not forwarded by E911, does that mean that each service can do their own dispatching? Does that mean that we can take backline calls, or anybody take backline calls? That's a question that I had, just seeking clarification on it. Thank you.
The answer would be that the dispatch, the determination of each call, if there's a contract and they're operating under that contract for a specific facility, that's not a 911 assigned case or call, and that it would therefore be for the provider to take care of that. If I'm understanding the question correctly.
So if you would look at section 320, section F. I'll give everybody time to turn to that section. Turn to your hymnals. That's what I said, it's like turn your hymnals. So, and this is what we've talked about before, if any provider decides that they're going to have a dispatch center at their place to provide for non-emergency transports and transfers, if you look at section F, it's on page 20, if you look at section 1, 2, and 3, it's provide for scheduling and monitoring non-emergency transports and transfers, work with the patients, hospitals, and other facilities to ensure the timely, efficient, and professional movement of patients. Maintain and monitor a single 24-hour number to receive requests for non-emergency transports and transfers. So maintain and provide a single system approved by the DFR chief to track all times associated with receipt, dispatch, and scheduled and actual arrival times for non-emergency transports. Also provide the EMS coordinator 24-hour live access to tracking system to monitor the efficiency of the operation. If you choose to have your own dispatch center for non-emergency transports and transfers only, it's got to be approved by the DFR chief. You have to provide me with 24 hours access so I can watch and see how it's monitored, how it does, and things like that. Also, if you have that and you have a truck that just takes a transfer from hospital A to Birmingham or wherever, that's one less truck that's going to be provided for the city of Decatur for an emergency call. So dispatch will need to know, hey, 328 is out for a transfer from here to here, just so they know. Does that help? You got a puzzled look on your face. And we've had this discussion before when you was talking about having your own dispatch at first response. And you can have a 24-hour number, 7-digit number that they call, but you're going to need to it's going to have to be approved by the DFR chief and access granted so the EMS coordinator can watch and make sure everything runs smoothly and timely and efficiently.
Anybody, any further? If there's no further, we'll adjourn at 2:54. Hey, our next meeting is November 9th, 2 p.m.